Okay, good afternoon, everyone, and thank you for joining us for Bloodwork Basics with Lori Pepper. She is a nurse practitioner with a background of over 20 years of experience specializing in hematology and oncology. She's originally from Delaware and earned her Bachelor of Science in Nursing from the University of Delaware and further advanced her education with a family nurse practitioner degree from Wilmington University. After working as a nurse practitioner for medical oncology hematology consultants or at Helen Graham for almost 20 years, she's currently the hematology medical affairs trainer for an oncology biotech company. She has a strong interest in hematology and a passion for patient education. So with no further ado, Lori, I will turn it over to you.
Thanks so much, Erica. I really appreciate it. And I want to thank everybody for joining today. As Erica said, my name is Lori Pepper, and my past occupation, I was a nurse practitioner for a long time, but I'm also a cancer survivor. So I also have that, those two things kind of make me really understand how important it is to learn more about your cancer treatment and management. So I'm very happy to be here today. And I think I'm going to shut off my camera because the sun is like getting in my face. So I'm just going to shut it off while I'm running the slides here. So like I said, I'm really happy to be here to provide this program today because learning about blood work can really empower you and help you make informed decisions to participate in your own healthcare. So please feel free to ask questions. You can put them in the chat. We can talk about them at the end throughout the presentation. However, this is really meant to be a general information session for you, and it's not a substitute for medical advice. And if you have any specific questions about your healthcare, please reach out to your cancer care team. So at the end of this program, I really hope that you will be able to explain the function of blood cells. I hope you'll understand complete blood count results. And I hope that you gain an overview of how blood cells are formed. And during this program, what I'm going to do for you is I'm going to explain what is a complete blood count, or else you'll probably hear it as CBC. Why is a CBC ordered? What are the components of blood? How are blood cells formed, and when to call your cancer care team. And I just wanted to mention that the reason I chose this topic is because when I first became a nurse practitioner, when patients would have testing done, whether it's x-rays or labs, they would find out the results after they made an appointment and come in and talk to the healthcare team, get the results, and explain to them what the results mean. But currently, with the electronic healthcare record and patients having the ability to go on the patient portal, tests are pretty much available in real time. And I think this is a great thing because patients definitely have the right to know about the results, what the results are. However, it can cause anxiety if you're looking at results and you don't understand them and you're not there with your healthcare provider to interpret them. So my hope is at the end of this, you'll have a better understanding of CBCs, and I hope it'll decrease your anxiety and give you another tool to be a more informed partner in your cancer experience. So the first thing is, what is a complete blood count? Well, very simply, a CBC is just a blood test that measures the number of different types of blood cells, such as red blood cells, white blood cells, and platelets. So why is a CBC ordered? Well, there's many reasons that it can be ordered. These are on the slide I listed some of the most common reasons. It may be to check your general health. Say, for example, that you're going to go see your family doctor for an annual checkup, and they may order different blood tests, and usually a CBC is one of them, just to get an idea of your general health. Or if you're going to have a surgical procedure, they may order it as pre-op work just to make sure that you don't have any complications due to your surgery. Another reason could be to diagnose a medical condition. So for example, if you went to see your family doctor and you were kind of tired and you're a little bit of short of breath, they may order this to see if you're anemic, to rule that out. Or any other like symptoms that you have, they may order it just to see if they can try to narrow down the diagnosis. So say you had a CBC order and you were found to have iron deficiency anemia. So the next reason would be to check on a medical condition. So say your doctor gave you iron tablets for your iron deficiency anemia. Well, they would recheck the CBC just to make sure that the iron deficiency is resolving and the treatment is working. And then another reason may be to check on a specific medical treatment. So say that you are being treated with a certain type of chemotherapy, and the side effect of the chemotherapy is to lower your counts. They may check a CPC intermittently just to see how your counts are doing, if they're going too low or not. So there's always plenty more reasons, but those are the main reasons why a CBC would be ordered. So I'm sure probably everybody on the call has had blood drawn, but just in case there's somebody on that has never had blood drawn. So for a CBC, there's nothing to do to prepare. And when you go into the lab tech will put a stretchy band on your upper arm. They'll find the best vein they want to go for in your hand or your arm, and they'll clean that vein with alcohol. They'll put a small needle into the vein. It'll just be a quick pinch. And then the blood will fill the tube that's attached to the needle. They'll remove the stretchy band, and then they'll put gauze and bandage on the needle site. And that's pretty much it. Very little risk with this, although you may have a small bruise afterwards. So blood basics. So the main components of blood, there's four main components. There's plasma, red blood cells, white blood cells, and platelets. And they all have a different function to keep you healthy. The first one I'm going to talk about is plasma. So when the lab tech draws your blood and they have it in the tube, they're going to take it in the back and they're going to put it in a machine, and it's going to spin it very fast for several minutes. And then after that's done, what this picture here is showing you is what it looks like after it's been spun. So the top layer is the plasma layer, and that's most of the amount of what your blood is. It's over half, it's 55% of the total volume. And basically, plasma is the liquid part of your blood that carries everything around, your red blood cells, your white blood cells, your platelets, but also water, proteins, electrolytes, hormones, antibodies. It's basically just carries everything around to keep you healthy, keep everything working correctly. And then the second part of that tube, the middle part, is going to be the smallest part. It's less than 1%. And that's called the Buffy coat. And that contains your white blood cells and platelets. And then the bottom part of the tube is going to be the red blood cells. And that's the second highest volume. That's about 45% of the total volume. And erythrocytes, the word that's on the slide there, that's just another term for red blood cells. So now I'm going to talk about red blood cells. So red blood cells carry a really important protein, and that protein is called hemoglobin. And that the function of hemoglobin is oxygen attaches to it. And when you breathe in oxygen into your lungs, that hemoglobin takes it around to your body and delivers it to your tissues. And then the rest, it goes to the rest of the body, and then it brings back carbon dioxide from your body and takes that to your lungs, so that when you exhale, you exhale your extra carbon dioxide. And there's several ways that, several tests that look at evaluate your red blood cells if you have the proper amounts. So the first one's hemoglobin. The second one is hematocrit. And hematocrit is going to be measured as a percentage. And basically, it's the percentage of your whole blood that is made up specifically of the red blood cells. So when you get your test results back, if they're abnormal, they can be low or they can be high. And I put some reasons on here. This is not all the reasons. These are some of the main reasons that it could be occurring. So if the hemoglobin hematocrit is low, it's called anemia. And there could be several reasons why that would be. Number one, bleeding. If you're bleeding and you're losing your hemoglobin, it's going to be low. There's certain types of chemotherapy that makes your counts go down, and that could give you anemia. If you're receiving radiation, depending on where the radiation site is, if it's close to the bone marrow, it could make your counts go down. And then, as I mentioned earlier, iron deficiency can make it low. And then there's certain types of vitamin deficiencies, such as B12, that can also cause anemia. Now, there's actually some causes for high levels. We usually worry about low, but there are some causes for high levels. And one of them is if you're a smoker, that can make your hemoglobin be higher. If you have heart or lung disease, that can make it higher. If you're dehydrated, that's kind of like a false elevation of your hemoglobin. It's just because you don't have as much fluid, and it makes your red blood cell count look like it's higher. And then living at high elevation. So at high altitudes, there's lower oxygen levels. And so then your body adjusts by increasing your hemoglobin levels to provide your body with more oxygen. And when you look at the actual lab result page, so this is just an example to show you. So for the red blood cell count, it'll usually be in million cells per microliter. And then you may see a range for men and a range for women. So the important thing to remember about ranges is that they're going to be different at different labs. So it's kind of hard to cross compare. Like one day you had your labs done at LabCorp, and the next time you had it done at Christiana, because they may have different ranges. So sometimes it helps if you get your labs done in the same lab. And the other thing about ranges are the labs get those numbers based on large groups of healthy men or healthy women. And it may not be what's normal for that large group may not be normal for you. So your normal numbers may be different than those ranges. So just keep that in mind. The next one on here is hematocrit. Like I told you, it's just a percentage of your red blood cells. So it's going to be read on here as a percentage. And then the hemoglobin. Hemoglobin is usually read as grams per deciliter. And then the other thing I wanted to talk about when you look at your results is if you're seeing H's and L's, that means the computer's marking it as high or low. And the thing to remember with that is the computer is just looking at numbers. For example, say you're a man and you went in and your hematocrit was 38%. It's going to mark it as low, but really it's just a little low. So I wouldn't get really concerned about that. And another thing to remember is that this is just a snapshot. So these numbers are what your numbers were at that time when you had that blood drawn. So sometimes it's more important to look at trends. So say, for example, when I was saying that the hematocrit was 38%. So maybe it gets rechecked in 4 weeks. And then it came back to normal, went to 40. So you probably won't worry about it. But say you went back in 4 weeks and now it's down to 36. So that looks like it might be trending down. So that might give more information than just looking at an absolute number. So now I'm going to talk about white blood cells. And white blood cells are really important because they protect the body from infection. They're much fewer in number than red blood cells, accounting, as I said earlier, about 1% of your blood. And the most common white blood cell is called the neutrophil, and it makes up about 55 to 70% of your total white blood cell count. So again, some reasons that it could be low or high, there's many, and I kind of put on the most common ones here that may pertain to you. So low levels. So a white blood cell is called a leukocyte. So if it's low, you may hear the term leukopenia. And then because the neutrophils are so important, you may hear the term neutropenia because the neutrophil is really important because it's really the first line of defense of all the white blood cells. When you get an infection, the neutrophils are going to get there first, and then they're going to call in all your other white blood cells to come in and back them up and help take care of that infection. So that's why you'll hear a lot about neutrophils and neutropenia. So some of the reasons that can make that low, again, I mentioned earlier, certain types of chemotherapy can make your counts go down. Again, the radiation site, if it's near your bone marrow, can make it go down. And then infections. Infections are a little interesting because they can either make your count go down or they can make it go up. Certain types of viruses may actually make it go down. For example, when I had COVID a couple years ago during the pandemic, I went in to get my count done afterwards, and my white count was down. And I had already had COVID. I didn't have any symptoms, but I had it rechecked and it was normal. It was just a late effect of COVID. But then again, if you have an acute infection and you're very symptomatic and it's bacterial, that's when you'll probably see the white blood cell count be high. And then also, if you have autoimmune disease, that may make your white blood cell count a little bit lower. Now, for high levels, infection, if you have any type of inflammation in your body, inflammation is caused by white blood cells reacting to something in your body, so that may make it high. There's certain types of cancer that may make the white blood cell count go high. And then there's certain medications that can make it go high. And one of the main ones that I think of is steroids. If you're on steroids, that can make your white blood cell count go high. Oh, went the wrong way. So when you're looking at the actual result, a CBC can be ordered with just a total white blood cell count, or the doctor, if they want to see what all the different parts of the white blood cells are, how much you have of them, they'll order a CBC with diff. And what that means is they want to know the differential. They want to know what are the percentages of all the white blood cells. So the top one on here is your total white blood cell count. That's all of them added up together. And the range is usually in billion cells per liter. And then when you look at the percentages, like I told you, neutrophils make up 55% to 70% of the total count. Lymphocytes are another type of white blood cells, and that makes up 20 to 40. And then monocytes 2 to 8, eosinophils 1 to 4, and basophils 0.5 to 1%. So that just gives your healthcare team information on how your white blood cells are working and if they need to look for anything else and order any other tests. So the last component I'm going to talk about here is platelets. And actually platelets are not cells, they're actually fragments of cells. I put a little white arrow on there to show you. So those little green squiggly things in the picture, they're representing platelets. And the main function of platelets is to help you stop bleeding. They function to help you clot. So if you have any type of, say you have a tear in one of your blood cell vessels, platelets are the first thing to get there, and then a bunch of them go and they form a bridge. And what that does is that calls in all the clotting factors to come in. They go through this whole cascade, and the end result is to form a fibrin clot, or you can think of it as a scab. So platelets are really important for that, just to make sure that you don't have unnecessary bleeding. So a platelet is the medical term is thrombocyte. So when those are low, you may hear the term thrombocytopenia. And some reasons for that, again, there's certain types of chemotherapy that make your counts go down. There's some autoimmune diseases that make it go down. And then there's certain types of cancer that can make it go down. And then,
Lori, just so you know, the screen sharing stopped. I'm not sure if I hit a button or you did. So sorry if you want to try to share again.
is it showing now?
Nope.
Hmm.
I'm seeing it.
Oh, you do?
You
Yeah,
do,
I
you
see
see
it
the
too.
screen? Okay.
Yeah.
I can see it too.
Sorry, it's just me. Go
Oh.
ahead.
Oh, sorry.
It's okay.
Um, what about that? Oh, high levels. So some reasons for high levels of platelets, there's certain types of cancer that can make it high. And then if you're bleeding because your body says we need more platelets, we're bleeding, your body's going to make more platelets and the level can be high. And then same with infections, sometimes platelet count will be high due to some infections. So when you look at the actual lab test, when you're looking at the paper or on your portal, the platelet count is going to be measured billion per liter, or 100,000 50 to 450,000 per microliter. So that's what you're going to see there. So how are blood cells formed? Blood cells are formed in the bone marrow. And I'm not sure if you've ever seen the inside of a bone marrow, like inside a chicken bone. You may have seen like there might be like red areas or there might be yellow areas. So they call that red marrow and yellow marrow. So inside the red bone marrow, there's these special cells called stem cells, and they have the very unique ability to turn into either a red blood cell, a white blood cell, or a platelet, depending on what your body needs. And every day, the bone marrow is producing billions of red blood cells, white blood cells, and platelets daily. So when should you call your cancer care team? So it's really important to have a good relationship with your cancer care team. And when you're there talking with them, ask them what symptoms they want you to call them for. And ask what symptoms they just want you to go to the emergency room. Don't take the time to call, just go to the emergency room. And then it's also important to ask them, okay, well, if the office or clinic is closed, who should I call? Is it the same number? And then more specifically about tests, if you're having tests ordered, whether it's a CBC or an X-ray, and you're not sure why, ask them. Say, why is this test being ordered? And if you're receiving treatment that, for example, I was saying that if there's certain types of chemotherapy that are going to make your counts go down, ask them. So when I start receiving this treatment, when should I expect my counts go down, and how long should I expect them to be down? But the best thing is just, if you have any questions, just ask your healthcare team. So that was the presentation. And then I just wanted to like have some fun facts with you. It's good to know, but it's nothing that you need to memorize or have a great knowledge about. I just thought it was interesting facts. So I was going to pose it to the audience. Does anyone know, once red blood cells are made in the bone marrow and they go out into the body, about how long they live in the body?
A day?
A little longer? Anybody else? A
A month.
little longer?
Oh, 2 years.
Too long. Good guess though. So it's about 120 days, which is about 4 months. So that's a respectable length of time. Okay, how about white blood cells?
A month?
A little shorter. They only last
A
about
week.
1 to 3 days. Yeah, it was about 1 to 3 days. So when you think about, like, a lot of times when I was in practice, if the patients were anemic, we could give them red blood cell transfusions. But when the white blood cell count, a lot of my patients would ask, well, why don't I get a white blood cell transfusion? And this is a reason. The white blood cells only live for like 1 to 3 days. So by the time it gets transfused, they wouldn't give you any benefit.
Hmm.
So how about platelets? How long do you think platelets live?
Oh. 2 months. Okay.
Close, 7 to 10 days. It's pretty close. But yeah, so they live a little bit longer than white blood cells. And that's the reason if your platelet count is low, that your doctor may order a platelet transfusion for you.
So I have a quick question about that. I know people that do like they do the platelet transfusions, like they go,
Mhm.
and give up their platelets. So
You mean
do
donate?
people that are receiving these platelets, don't they then need platelets constantly? Because if it's only going to last 7 to 10 days.
Right. Yeah, so you're talking about donors, platelet donors,
Yes,
correct?
yes.
Yeah. Yeah, so it depends on the reason. So, you know what I mean? If you're getting chemo and your platelets went down and you were having a little bit of bleeding, you may have a platelet transfusion ordered. But as the chemotherapy wears off, your bone marrow will kick back in and your own platelet count will come up. So you only need one transfusion.
Oh, gotcha.
So
Okay.
yeah, so it just
Yeah.
depends on the reason.
Right.
Say someone's gone through something more extreme, like a stem cell transplant, where their platelet count is going to be low for a longer amount of time. So they may need frequent platelet transfusions.
Okay.
So it just depends on the cause of why they need it.
Right.
But
Okay.
but that's a good question.
Yeah, I just remember people saying, "Oh yeah, I'm a platelet donor," and they call me whatever X amount of times to do it.
Right.
You know.
And that's why, because some patients do need a lot.
Mhm.
But yeah, it takes, I try to be a platelet donor, but what they do when they take it off and you're in the lab, they put a needle in both of your arms and they hook you up to a machine.
Oh,
So
right.
they draw off all your blood and then it goes through the machine and the machine recognizes platelets and puts them in the little baggie. And
Is
then
it the phoresis thing?
yes,
Yeah.
exactly,
Okay.
phoresis. And then the rest of the blood gets put back in your other arm. But you have to have really good veins for that. So that's why if you have really good veins and you're a good donor, they'll keep bugging you and asking you to come in and donate.
Gotcha. Yeah, I do not have good veins, so I don't have
I
to.
don't either. They told me not to come back, actually. Like, okay.
I have a question about the formation of the blood cells. They form
Sure.
in the bone marrow, right?
Correct.
And then somehow how do they get from the bone marrow to the bloodstream? Because there's the bone in between. How do they get there?
Yeah, that's a good question. So they're formed in there and they actually mature a little bit in there. And then when they're ready to go out, the bone actually does have some micro vessels where it can go in and out.
Hmm.
So I know it
Okay.
looks solid, but there are some vessels in there where they
Just
can
kind of porous a
get
little
out.
bit.
Yeah,
Yeah.
Okay, thanks.
yeah, that makes sense. Like I never thought about it. I always assumed everybody knew that. So I'm glad you asked.
I have a question, where you mentioned signs of cancer in different places in here. Is it only blood cancers that you would see evidence of, or can other cancers affect the blood?
Predominantly it's blood cancers that will change the CBC, make them like higher or lower. It's predominantly hematology. I'm trying to think if there's any solid tumor cancers that would do that. There might be, I just can't think of off the top of my head. But yeah, it's predominantly blood cancers. And then I had one more fun fact for you.
Okay.
What percentage of your weight is blood?
Oh boy.
So if you go in there and they weigh you and it weighs more than you want it to be, just say, hey, it's just my blood weight.
43.
Close. 78% of your weight. So that means for an average sized man, it's about 12 pints. And for an average sized woman, it's about 9 pints. Any other questions?
I have a question.
Yes.
This is Liz.
Hi, Liz.
I get blood work done every month, and I have, in addition to looks like a hematology, I guess it says PT portal, a hematology patient portal. They also have a whole chemistry piece to it.
Mhm.
Could you talk a little bit about that part of the blood test?
Yeah, so when they're looking at chemistries, different chemistries can give you information about different parts of your body. I mean, I can come back and do another whole talk on that if you guys would like. I'd be happy to do that. But in brief, there's certain tests that they'll do, like if they want to evaluate your kidneys, right? So they'll order a creatinine and a BUN because they're really good measurement of how well your kidneys are working. There is another test that may be ordered. It's called LDH. It's kind of a non-specific test, but if you have some types of cancer that can tell you if it's fast growing or not, it's kind of non-specific. It could be something like cholesterol. They want to see what your cholesterol is. That's a chemistry test. Trying to think of what other tests are on there.
CO2?
CO2. So that's what I was explaining about the hemoglobin. So your body has a balance of, it balances out how much oxygen and how much carbon dioxide you have. And it involves your heart, your lungs, and your kidneys. And you also have an acid base balance. And that's where the CO2 comes in. It helps with that balance of your acid base balance in your kidneys to make sure they're working correctly. So the CO2 level kind of gives you information about how your heart, lungs, and kidneys are working.
And so if that's high, what might that suggest?
There's a lot of reasons for that. Again, if you're a smoker, your CO2 level might be higher. Sometimes with infection, your CO2 may be higher. If you have like, any problems with your kidneys, it can make it higher. There's a lot of different reasons.
I have a question. I've read about a C factor or something. Is there something, a test that can, and what is it in the blood that tells you that you might have cancer?
Yeah, that's a good question. It would be really nice if we had just one blood test that could tell you if you have cancer or not. Unfortunately, we don't have that right now. And that's why when you're being diagnosed, you have to go through like so many tests and, blood work and x-rays and biopsies and things like that. But there are some tests that kind of give you an idea if there's a cancer involved. But honestly, the best way to know if you have cancer or not is having a biopsy. Because even if your blood work may suggest something, a biopsy is just the best way to know if you have it or not. It's the most accurate way, and it'll give you the most information. And honestly, most doctors won't treat you unless they have that information.
Lori, what are the cancer marker tests? Is there a different cancer marker test for every different kind of cancer? I have the CA 27.29 for breast cancer.
Yeah, that's a good point. There are a lot of different markers that they look at. So that's one for breast cancer. There's different ones for like prostate. They look at the PSA. But yeah, it just depends on the type of cancer. And that's where your healthcare team can actually tell you, these are the tests that we need to order for you. And then not only to diagnose, those tests can help measure how your treatment's working. For example, like an ovary test, I'm blanking on what the number is for that. But I'm blanking on it. But anyway, if you're, as you're being treated, they can look at that number and see and make sure that the treatment's working by watching that number come down. But yeah.
So what is it in that, in those marker tests that, I mean, what are they looking for? What specifically in the blood? Or in my case, mine's in my chemistry, the chemistry portion of my blood test. I just
Right.
curious about how the marker tests work.
Yeah, it just depends on well, it's all going to be in that plasma component that I was talking about earlier. But it's just going to depend on what the test that's ordered. Like there's one called a CEA, which it's basically an antigen. That's what the A stands for. And then MPSA, the A stands for antigen. But other chemistries may be, you know, a different type of marker in the blood that they're looking for. But it's all going to be in the plasma part of the blood when it's drawn, if that makes sense.
So, Lori, we had a comment in the chat section about my neutrophils always seem high. So, could you maybe talk about what might be the cause of that?
Sure. Like I said, there's a lot of different reasons. And one of my when I was working with my hematologist, when we would get a new patient that came in with that, we would do a lot of different tests to try to narrow it down exactly what's causing that. As I said earlier, there's certain types of blood cancers that could do that. But a lot of times, in my past experience, it was the patient was a smoker, and it just made the neutrophil count go up. But there's certain autoimmune diseases. It could be certain medications. So whenever you have that, you just have to look at the whole picture. Whoever's, you know, your healthcare provider that's diagnosing and following you, they'll look at the whole picture of what's going on with you at the time. And then, like I said earlier, those ranges is just a population of people. That might be your normal neutrophil count. Like maybe you just didn't fall into that range.
Can I ask a question though about the neutrophils? That's
Mhm.
me, it's Tracy. I'm sorry. How would
No
that work?
worries. No worries.
So with that, because you know, this is coming from like a primary doctor. So I'm a colorectal cancer patient who is currently 4 years, no evidence of disease right now. So recently I've noticed, like when I've had lab work done, is it something that I should mention to my oncologist, or is it something that maybe my oncologist himself would then question once I have a follow-up with him? And I'm now every 6 months with my oncologist.
Right. Yeah, I would, well, who do you see next? Your family doctor or your
So this was from, you know, an incident that from my family doctor. So I don't see my oncologist until April. So I have all of these appointments kind of scheduled right around the same time. So I didn't know if that was
Got you.
something that maybe should be concerning and I should reach out to them and say, hey, can you take a look at this lab work?
Yeah, I think the first step would be to go back to the ordering doctor and just ask them to explain it to you, because they know your whole history and everything that's going on. That would be my first step. I would go back to the doctor who ordered it. And then if they're not sure and you're not happy with that answer, I would go ahead and call your oncologist.
Okay. Thank you.
Sure.
And
I have a
Lori,
question about anemia.
Okay.
My daughter had severe pneumonia and was found anemic then. And then I think they gave her a transfusion while she was in the hospital. And then several months later, it turned out she was anemic again, and she just had a transfusion, and she felt, you know, much better after that. Now she's on an iron supplement. But is it generally like anemia, you know, when it recurs like that, is it, you know, probably an iron deficiency, or it just depends?
Well, it depends on the person. I would say for women who are still have their menses,
Yeah, she
that's
doesn't.
she doesn't.
Yeah.
Okay, so that's the usual culprit, right?
Okay.
But if not, yeah, I probably would talk to whoever is ordering the transfusions. They may have already done a workup on her
Mhm.
and have found the cause. But whoever is ordering the transfusions, I would ask them, they may already know the answer, but I would ask them,
Mhm.
what's the cause of this?
Right. I think that's what led to the iron supplement, but I was just curious, in the context of what we were talking about, but
Right. And
Mhm.
and the important thing to remember about iron um, is that iron stays in your body. It doesn't fluctuate like other things. So if you're anemic and your iron levels are normal, you shouldn't be taking an iron supplement, because actually if your iron levels are too high, it can hurt you.
Hmm.
So that's why
Mhm.
I never recommend to people to take an iron supplement if they're anemic unless they
Mhm.
have their iron levels checked. Because you don't want to be taking iron if you don't need it.
Okay, I'll ask her about that. It's her history, so
Right, exactly.
yeah.
And yeah, exactly. And then, and there may be something else going on that's on, that her doctor would have all the information.
Mhm. Thank you.
Sure.
So we do have another chat question, which is, what do the terms absolute and manual mean in blood tests?
Okay, that's a good question. So absolute means that's the total number. For like when I was talking about the white blood cell count, the absolute number is that total number. Manual means that there's a lab tech in there that knows a lot about blood, and they'll make a smear, they'll take a drop of blood, put it on a slide with a little bit of stain, and they'll look at it under the microscope. And they'll do that if they see any abnormalities in the blood. And then they will actually look, and because maybe the machine was wrong, and they'll do a manual count. And that lets the doctor know that the lab tech actually looked at it. And that was what they got. They can either agree with it or disagree with it. And then they'll actually look at they can look for like abnormal cells as well. And actually the doctor that I used to work with, he would look at every single patient that came in. He would have a slide of their blood, and he would look at it himself to make sure that all the numbers were accurate.
Hmm. Wow.
Any other questions? You guys asked some fantastic questions.
I do have one more slide. The last thing I really wanted to mention is that the importance of using the internet wisely. So if you're like me, whenever I see or hear something that I don't know, I immediately Google it, like right on my phone. I'll Google it right away. And the internet is amazing. It contains a lot of great information. However, there are a lot of sites that are really not accurate. So I listed a few on here, which you probably are already aware of, especially the cancer support community. They have an excellent website. Um, but I would really encourage you to talk to your oncologist and ask them if they have some websites that they think would be like really good for you, specific to your healthcare. And that was it. And I wanted to thank everybody for attending, and I really hope that this was helpful for you. And I want to give a huge thank you to Erica for setting this up and doing the advertising for it. And we have a couple of minutes. If anybody has any more questions, I'm happy to field them for you.
Lori, what does RDW stand for in blood work results?
Good question. So there's a lot of different, I didn't go into all the details because I just wanted to give you basics and I didn't want to bog you down, but it's a good question. RDW stands for red cell distribution width. And basically that's just so the red blood cells are supposed to be a certain size, and sometimes they're smaller and sometimes they're bigger based on different health conditions. For example, iron deficiency anemia, the cells are going to be smaller. For vitamin B12 deficiency, they're going to be bigger. So what that RDW is, it kind of gives you an average of the sizes. Like if there's small ones and big ones, it just gives you an idea of the sizes. And it just gives a little bit more information if you're trying to figure out why somebody's anemic or not.
Oh, thank you.
Sure.
Someone also asked, what is the anion gap? ANION gap.
Oh, anion gap.
Anion.
So when I was talking about the acid-base balance, that's just a way to measure your acid-base levels. It just lets the doctor know, like, if you're being your blood's a little too acidic, or if your blood's a little on the basic side. It just gives more information about that. It tends to be more important for patients who are in the hospital, and if they're having, problems with breathing or problems with their kidneys, and it's really important to know what that is.
And what is macrocytosis?
So that's the term for, as I was saying, that the red blood cells can be big or they could be small. Macrocytosis means they're big cells. And that's, if we're trying to figure out what anemia is, first thing I would think of is B12 or folate. But sometimes, like, if you have liver disease, it can make them bigger. There's other different things that can make it bigger, but it just gives more information to the person trying to diagnose why you're anemic.
When you were talking about acid and base, is is your blood affected in that way by diet, or is it just a sign of malfunction of an organ?
Yeah, I don't think, I mean, I guess it can be affected by diet. If you're eating, trying to think what you would be eating to affect it. But normally it's just how the health of your body. If your kidneys are working well, if your heart and lungs are working well. Again, if you're in the hospital, like, certain treatments or medications they're giving you can kind of alter it. Yeah, I can't think of anything that you could eat that would really.
So is it similar to the scale, say, for soil? You have acid to alkaline. It's the same relationship. You want it in the middle. Okay.
Yep.
Okay.
That your body needs to be a certain range of pH, just like in the soil.
Right. Okay. Thank you.
Cool. Maybe if you were eating a lot of baking soda, that would make you more basic, but I don't think anybody's doing that.
I think you'd have a different problem if you were eating a lot of baking.
Not for long.
Well, lots of thank yous, Lori, in the chat.
Oh, good.
Thank you all for joining us today. You can always, if you have other questions you want me to pass along to Lori, you can always email them to me, or we can figure them out. Sounds like we might have to invite Lori back for a blood not so basics for next time.
Blood
chemistry basics.
Yeah, exactly. So thanks again, everyone. And
Thank you.
Yes. Thanks, Erica, and thanks, Lori. It was very informative.
Oh, good.